Thank you for inviting the BioResource here today. It's really nice to be here. I think the rare diseases community is the friendliest and most welcoming when I come out to any event, and it's always a pleasure to be here. It's such a hopeful space as well. It's lovely. So this is not rare disease specific, but there are elements that I think are, well worth considering for rare diseases and the work we've done that's led to building D-CYPHR. So D-CYPHR stands for DNA Children and Young People's Health Resource. And I'm not going to keep saying that. I am just going to say D-CYPHR. And I have to check the website every time I have to spell it out somewhere because I forget what it means. So the BioResource spans across a lot of different research disease areas and also the general population. We work across England, funded by the National Institute for Health and Care Research, working with the clinical research facilities, and about 70 other sites on top of that to deliver the recruitment programs we have. We're an infrastructure that is designed to make research easier for people in terms of being able to identify individuals and then invite them into further research studies as well. And we really want to be part of that step forward from your bench research into transformational research for medical practice. So D-CYPHR builds on a lot of work we've already done in the BioResource, including young participants. So they've participated widely across different themes, but not necessarily in huge numbers. And D-CYPHR brings that together on a much wider scale. So you can see there, we've had participants in rare diseases, and I will come on to that in more detail in a minute. We have a paediatric inflammatory bowel disease cohort. When we recruited from the COVID-19 pandemic, we did include young people and children who were affected by COVID-19 as well. And then across some of our other themes that are ongoing at the moment. So in improving Black health outcomes, our sickle cell cohort includes recruitment of child and young people as well. And then across our mental health themes as well, we're about to start a recruitment of young people in our eating disorders program. Oh, skipped one. Is that the right one? Yeah, sorry. So for rare diseases, rare diseases has been recruiting for about 12 years now, active across 50 different sites and 60 different projects. And over 50 of those projects include recruitment of children and young people, but also within that 50, several are young people focused only. And currently, because people get older every year, there are about 1,600 people aged under 16 in rare diseases. That number would have been larger over time. So we've got a few just areas to touch on, I think, in terms of where we've specifically been involved in recruitment of young people. So cystic fibrosis has been a large recruiting area, as well as smaller rare disease groups such as Ring 20, and we've done a lot of work with Genomics England as well in delivering this and being involved in the 100,000 Genomes project. So out of some of that work that we've done with children and young people in rare diseases, we've built up D-CYPHR in the past couple of years. So there are various statistics and figures that I could that are on the screen, so I won't read them all out, about sort of the impact of healthcare on children. I think a new report came out on Monday, or somebody shared with me on Monday, about some of the gaps in support for children and young people in healthcare as well. And from a research perspective, whilst there's research that might pertain to conditions affecting children, children aren't necessarily involved in that research. It might be conducted with adults, and it might be the design might not include children in playing a key role in giving their voice to shaping how those studies happen. So we're calling it a world first. I hope no one can challenge that today. So this is that all families across the UK essentially. And I'll explain how we've made that possible. Between 0 and 15, joining and providing consent. So the parents provide consent, and we have assent for the children as well. we've been doing this online, so we do a lot of marketing via social media, and then people sign up online, you consent online, and then we post out saliva collection kits to them. And then through our network of centres, we're now also in various clinics in different NHS sites, and people are joining that way as well. And wherever there are children who can't provide a saliva sample, because it's not the nicest thing to do, people can join without giving a sample as well. So we do have literally newborns joining who aren't giving a sample at the moment, but are part of this initiative as well. So like I said, this has been done online with various marketing approaches, and I'll talk about one specifically, so social media. So we hadn't done this before. It had been done a little bit in our mental health programs, and that's the model we sort of adapted for this, working with an agency to know how you create your algorithms on Facebook to find the right people, looking at different demographics and designing advertising materials that resonate with those demographics that are then built with community groups as well. So the advertising is designed with community groups as well. And we've got content that comes from various different places. So community groups, our sort of natural content that we create ourselves, influencers, doctors, and the actual volunteers are involved as well. And I will talk a bit more about the diverse campaign that we've moved into now. So whereas we were just very broadly, anyone who I guess fit the criteria of being the right age to have children, essentially in social media being sort of fed these adverts, if you like. We've now kind of narrowed our focus, but enriched our focus with development of materials with community groups to address specific concerns that different groups might have and to create content that resonates with them. So just some examples of who we've worked with across our social media. So Zan van Tulleken has been one of our main ambassadors, especially in the first couple of years, with videos visiting our labs as well. And then we've had Giles Yeo involved. And then you can see we've also worked with SAHA, community group in Leicester, and our young ambassadors. So our participants themselves have also been involved. And videos from A-Star spoken word artist as well. The QR code there will take you to that video, which is amazing to watch as well. So he has done one with us for D-CYPHR and another one in our Improving Black Health Outcomes programme as well. There we go, sorry. And we've worked with Beacon. So we have put together some social media collaboration there to, talk through the importance of research into rare diseases and the inclusion of children and young people in that research, and highlight the changes. I don't want to say something more positive than changes. The amazing work that's happening and the amazing research that is occurring, and kind of widening that knowledge around rare diseases as well. Oh, I'm having some trouble with these slides, sorry. So this is being built with young people, which I think is really important. So from its very kind of first inception, we worked with Anna Freud and identifying representatives across different schools, not just teachers, not just staff, but with children themselves to decide the name. The branding that you see has all been designed with our young ambassadors as well. And the messaging has been designed with children and young people to try and ensure that it appeals to children and young people. And these are just a couple of examples. So you can also find online a video with a few of our young ambassadors talking about why they're involved in the research, how easy it is, and what is so important to them about it. And then just in terms of how it's going, so it's been 2.5 years now, I think. So we launched in June 2023. And by the end of 2023, we had about 3,000 people consented, and we'd received about 1,200 samples. And as of last week, I think it was, we've had over 33,000 people who've been in touch to say they're interested. We've actually now had over 12,000 people give their consent to sign up, and we've received over 6,000 samples. And I mentioned we'd had the diversity campaign. So we do track our diversity in the BioResource constantly, and we collect demographic information that allows us to really see how the BioResource is made up, where we fall short of being representative of the country, and allows us to really consider how we can change that. So that was part of the diversity campaign, and you can see from looking at the July 2023 data around ethnicity compared to most recently, we have sort of increased that diversity in the programme, in our reach of who we are reaching, those hard to reach groups that are only hard to reach if you don't try. And how by working with the community groups we have, and with the young ambassadors that we have, the parent ambassadors we have, to really focus this on what matters to families, to really drive forward engagement across a diverse group of people. And I think I do have a slide in a minute that does show you the geographical diversity of this group as well. So we've done a lot of our work to do this with an organisation called Equality Health, and we've worked with four community groups in particular: Caribbean and African Health Network, South Asian Health Action, Black Health Initiative, and Inclusive North. So they've been across the country as well. And these are just some examples of some of the amazing events we've had the opportunity to attend with representatives from the community groups, because none of this would be possible without those people in the community who are trusted, who know as much about D-CYPHR as we do. They probably know more than I do, for sure. And they're actually, they're the ones that are advocating for the importance of this kind of work. And as promised, this is the coverage across the country. So current top 5 recruiting regions, but we have had people from literally as far north in Scotland as you can get on the islands, right through to the bottom of England as well. So it's not just the ethnicity in terms of diversity, it's that geographical diversity and the socioeconomic differences across the country as well. So by working through social media, we're able to reach out to areas that don't necessarily have research active hospitals. You have coastal areas considered, rural areas. Anyone is able to take part if they can get on the internet, potentially, appreciating that can be a factor for people, obviously, as well. But we also have a really nice range of ages as well. Like I said, we do literally have people who aren't a year old in this programme, and we have people that are, join as a 15-year-old and 2 weeks later, as far as our research context is concerned, become an adult and turn 16. And we also have the provision to invite them to continue to be in the BioResource beyond 15 as well. So we reach out to people once they've turned 16, explain further about the BioResource and what we do, and ask if they'd like to continue to be a part of that. We collect self-reported or family-reported health information. And interestingly, but I suppose sadly as well, we can see some very clear data around children and young people's health, the distribution of mental health conditions across the programme, and the numbers as people enter their teens is obviously very sad. And actually, one of the big areas of interest we've had in research so far has been around mental health. I think including young people in that research is so important to sort of really consider their perspective and experience of that. And then physical conditions as well. There is a very high proportion of individuals in D-CYPHR with a physical health condition. I don't think that's necessarily, it's not that it necessarily represents the distribution of individuals in the country, but I think people who experience health challenges are that bit more interested in being involved in research and can see its huge benefit. So we are, in a sense, condition agnostic. Anybody can join. We do regularly get comments saying, oh, my child's already got a genetic diagnosis, can I join? And of course they can join. We're able to, by chance, create little cohorts of people with certain conditions. And it is something we've worked with various smaller rare disease groups to sort of build a collaboration, do some advertising and marketing for them to be able to build a home for a small cohort of people that can then be introduced and, you know, play a role in researching those areas and offering some support in delivering that. So just an example of that, the research we've done so far. This is a mental health study. This was people aged 11 to 19. So we used both our D-CYPHR cohort and our anxiety and depression cohort to include people in this. We were one of the highest recruiters. We've been one of the highest recruiters to this study, and it's been pivotal in boosting the success of the recruitment. This is a sort of gaming platform approach to moderate depression, with individuals sort of playing through an app game to explore their current condition. Which has been really successful and really well received by the participants as well. Families do make time for research. This is one that's done online, so it might be slightly simpler, but we do have one that's involved coming in and potentially staying overnight as well for to give samples and have various measurements to build separate study to this, sorry, to build a resource of information that can be used as a standardized measurements in comparison to people with metabolic conditions potentially. So we have found that families are incredibly engaged in research and are willing to give up their time, make time, and really want to be involved in this. And we will be moving out into other health-related areas in the new year as well. So yeah, just to summarise, we are really trying to bridge that gap between the known need for improvements in children and young people's health by involving them in the research that is required to make those changes. And we are very much led by our ambassadors, our advocates, our communities to produce the materials that demonstrate the worth of this, and that will hopefully then resonate with the people we want to involve. And thank you to everyone who's been involved in that as well. Thank you.